So welcome everybody to part 2 of your introduction to policy and management, the human resources for health, global and South African context. So we'll be continuing now with the learning outcomes in terms of further describing the global context of human resources for health. So as was mentioned in part 1, the challenges that we are talking about at a global level will be mirrored at a national, a local level as well. So looking at the slide, I want you just to think about again those global health workforce report dimensions in terms of the availability, accessibility, acceptability, and the quality as well. And what are the ones that we've already covered? So that will include the shortage, the skills mix imbalances, so referring with reference to the competencies as well, but also looking at, if you are a healthcare worker, what are the challenges that you've always known have been there pre-COVID, and what are the ones that have now been highlighted by the pandemic environment. And especially if we look at the ones about adapting education content and strategies to match current disease profiles. Remember that education to a large extent has become virtual as well. So how to ensure that you're able to train students appropriately without giving them, in a virtual environment, without giving them that authentic experience of seeing a patient. How are you ensuring that you are still able to then graduate a cohort of healthcare professionals who will be able to treat a patient with hypertension, with diabetes, with HIV as well. So looking at health professions education, it's become a challenge to academics, to educationalists, to institutions to say, what can you do now to ensure that you are still able to graduate a cohort that would be competent and skilled to treat the burden of disease, to meet societal needs as well. And again, the next one, in terms of keeping health workers motivated, how are you able to ensure that your environment is enabling, that it is supportive? And with COVID, the mental health, we've always known that our mental health, our estimates are not reflective or in terms of what it actually is, that it's always been underestimated. So how are we able to see that our nurses, our doctors, our occupational therapists, how are they able to not just do management of their patients, but also self-management as well? And then the other ones, I think, speak to more, again, the building blocks. So with health workers, in terms of human resources, for management, the planning, the systems as well, the financing that we said from the Global Economic Forum, that is really critical to ensure that you have a sustainable health workforce. There needs to be a funding plan that is supported and that is allocated appropriately as well. So this is just a list, but go back and look at what those 4 dimensions are and see if you are able already to feed some of this or match them according to those 4 dimensions of the Global Health Workforce Network report. So in part 1, I alluded to the push and pull factors that should be considered in terms of the inequitable distribution between countries. And again, and this slide and the two after this, I'm sure if you are a health worker, it could resonate with you in terms of, for example, push factors of working in a dangerous environment, of your exposure to, example, HIV, HIV or TB, or any type of abuse, or within your work environment, especially if you are in that clinical one as well. But in terms of the pull factors, in terms of better working conditions and more career opportunities as well. But I think the more interesting slide is the one two from now, where the article was regarding what are the reasons for the migration to the migration of healthcare workers from South Africa. And for example, one's looking at not just the living conditions but the working conditions, looking at the reasons in terms of levels of corruption, in terms of actually looking at the safety of not only the health care worker but also the family as well, of the future of children, of the family members as well within South Africa, of the personal, the security in the workplace. So a different type of, I don't want to say, because it's not different to the push factors, but I think again during COVID, these have been highlighted again, of why a healthcare worker or would feel that somebody who is obviously very skilled is unable to tolerate the environment and they need to go somewhere else as well. And whether solutions that are put in place would be sufficient to actually retain that expertise within South Africa. So that's where offering somebody, higher wages, a higher salary may not make a difference at all. If you fear for your life, for the life of your children, if the corruption that you're seeing around you, you're just not able to identify with the society anymore. Earning more money may not be, that incentive that will actually make you want to stay. So again, that looking at the human resources for health crisis, it really needs to, I think, be contextualized and to come up with solutions, not just for the health workforce, but I think society in general, that will make people want to stay and to contribute. And again, just emphasizing the critical role that the health workforce plays in the attainment of outcomes and universal health coverage, and I think society in general. So it's just important to reflect on that over these few slides. The next few slides talk about what are these 5 overarching recommendations to address the human resources for health crisis. And again, going back to the part 1, Global Health Workforce Network, those dimensions of that report, looking at what are the issues regarding the availability, acceptability, accessibility, and the quality of the health workforce that is preventing, it's not the only thing, but it's a challenge in terms of the attainment of universal health coverage. So for example, the first one about strengthening the governance frameworks. So it's looking at what is our health professions, our education like, how do we teach, who do we teach, what can be strengthened, what can be reviewed in terms of competencies and in terms of gaps of competencies that we've seen highlighted during the pandemic, looking at the migration of health workers, what are those push and pull factors, whether we can do anything about it at our level, or whether there are more societal and structural issues that need to be addressed. And then I think governance, again, looking at the pandemic, of what were lessons that we learned from public-private partnerships, can it be used to ensure that there's a health workforce that is equitably distributed, that is accessible, that is trained. So yes, the first one about governance, about policies, and about strategies as well that need to be taken into consideration. The second one talks about rebalancing the healthcare task, and is about ensuring that the skills mix is appropriate, but that the healthcare worker, that cadre, that they are used appropriately. So task shifting, task delegation comes into play. Creating a cadre of healthcare workers, for example, like clinical associates, that they are used appropriately, that they are retained. That's part of the balancing the healthcare task, and it shows that it also means that we are using the stock health workforce appropriately, so efficiently as well. So the next two slides refer to the other recommendations of using technology appropriately. And again, COVID has highlighted where we can use technology to ensure that patients are able to access the health workforce safely and appropriately as well. It may not be cost effective, and there of course will be I think negative, not completely negative consequences, but drawbacks in terms of not having a face-to-face physical consultation, but that there is a place for technology in that consultation, but also within the education of the health professions education of students as well. And the other two refer to the care models, reviewing, I think, what are the care models that are needed at different levels of the healthcare system, and perhaps according to what that societal need is, so according to what the disease patterns are as well. And then finally, about striving to have a workforce that is gender balanced, but that also takes into account, I think, challenges, across different industries in terms of appropriate remuneration, working environments for women, before, for example, before, after pregnancy, maternity care as well, and needs. So it's about sustaining or creating a workforce that is sustainable and gender balanced, and again feeds into that acceptability and of the global health workforce network, the dimension as well, because we do know that that there is a mismatch sometimes between what is available and what is actually needed from by a community or by a patient as well, that may feel more comfortable dealing with somebody who is that they are able to relate to more. And then we've come to the end of part 2.